Welcome to this episode of Your Lifestyle is Your Medicine. Now, this week we have Dr. Amy Novotny on the show. She's a breathwork specialist who uses position, posture, and breathing techniques to get people out of pain, avoid surgery, and get off medications. She's developed her own method of helping people beat pain using the PABR method, which stands for Pain, Awareness, Breathing, and Relief. Amy is a multiple marathon runner, ultra marathon runner, and a truly original thinker. This is going to be a very interesting interview. Amy, welcome to the show.
Thank you so much for having me on, Ed. It's a pleasure to be here.
I'm excited to learn about your journey and how you've developed your PABR. We'll talk about what that means in a minute, and your journey through your sort of career as a doctor of physical therapy and how you've changed that into your basically your own thing. I'm really excited to hear about that.
Yeah.
So, should we start at the beginning?
Sure, we can. And just even before that, I've always been fascinated by life, always been curious, life, environment, all of that. And so when I got into college, I originally was going in ecology and biology, and then I became fascinated with humans and just humans in general and why people are always in aches and pains. And I ended up going into physical therapy school for graduate work and got my doctorate in that. And so then I graduated and, you start off fresh, new grad, a career, and you're excited. And after a few years, like, wait a second. Okay, majority of people are getting better, but there's this huge segment of the population where they have chronic pain. And stuff that we would tell them to do didn't really work. I'm like, wait a second. If this is the stuff that we're told to help people, it's not working for this segment. Why not? If we're basing what we're told on biology and physiology and science, then it should work for everyone's bodies, but it doesn't. And at the time, I was approached to become a director of a different clinic, and I had to learn something called the Postural Restoration Institute approach. And so I started looking at that, and that looked at how we have asymmetries in our body. So what you look like on the outside, we're somewhat symmetrical, but on the inside, the stuff that's attached to organs and bones and tissues in your trunk, it's not symmetrical. And so that leads to us falling into certain patterns. And so I started diving into that. I became really interested in PRI and took a ton of courses. And that helped some people with chronic pain, but that wasn't the end all. And I started then experimenting on myself. I'm like, okay, I'm an endurance athlete. I'm running to train to qualify for the Boston Marathon, and I was running 8 miles 3 times a week on a treadmill, which if you run on a treadmill, some people love it. Some people think it's the most boring thing in the world.
It's not my thing.
Mine either anymore, but at the time I was doing it, and I started experimenting with my own way I held my body position and the way I breathe. So the mechanics of breathing, not breath work in the traditional sense. And I realized I could get myself out of that chronic pain very quickly. And when I say chronic pain, a lot of endurance athletes have some type of ache or pain that's going on. And they're usually in physical therapy, learning to manage it. But I got to the point where I didn't have to foam roll, stretch, scrape, any of the things that I was teaching people how to do, I stopped doing. I could get off a treadmill after running 8 miles and I felt like I just jumped on, and I was like, wow, this is great.
Let me interrupt you there. So that's
sure.
So you took the knowledge you had from the PRI. I trained with a guy, Fred. I forget his last name. Fred. Someone who did that. He told me about some of that stuff, zones of apposition and so on. Fascinating stuff.
Yes.
The diaphragm. And how that works. And people overbreathe, and so on. And so you took that, and you're running, and you started applying it to yourself whilst running. Is that right?
Yeah, it was not PRI stuff. I started experimenting on my own. I had the knowledge in my head of PRI stuff, but I didn't take their stuff and apply it necessarily while I was running. I just said, I'm going to start messing with my own rib cage and the mechanics of how I breathe. Irregardless of what PRI is shifting and doing different things, I was just like, I'm just going to start playing with things. And when I did that, it felt like my whole body just calmed down. And it felt like my hips freed up. And I felt like in the US, they have this cartoon, The Coyote and the Roadrunner. And the Roadrunner running and, and the legs are going and
Mhm.
and its body is still. It literally felt like that my legs could just do this nice turnover and it was not taxing me at all.
Wow.
And so I realized that I was calming down the fight or flight nervous system to allow that tension that develops when we're in stress mode. I was able to get that to release while I was
Mhm.
running on the treadmill at a fast pace, 8 miles in an hour, which is a decent
Yeah.
clip. And so I realized, okay, so I'm learning how to calm down my nervous system. How can I take my knowledge of anatomy and physiology, the influence of PRI, the influences of all the other continuing
Every,
ed courses
everything you've
and
done. Yeah.
doctoral, all of it. How do I mesh it together and to make sense out of it? And it took some years of experimenting. And I started playing with it on people who would come to see me for physical therapy. I said, hey, can I try this other
Mhm.
stuff on you? Some people said yes, some people said no. And I said, okay, well, do what you're okay with. But the people who said yes, they got better a lot faster than
Mhm.
traditional timeframes. And so, and of course, just like you're trying anything new, you make a ton of mistakes. You flub up. You're like, oh, okay, that obviously didn't work.
Mhm.
And so, why didn't it work with that person? And so, it was a discovery of, okay, if it didn't work for them, maybe they weren't ready and there's some other steps I have to do beforehand for it to work. And I would do that and then it would work. And so it was a discovery over several years into this process I now call the PABR method, which stands for pain awareness breathing relief, PABR. And even then, it took me a while to get to that point, several years. And people started coming around the country to see me, and it led me to being hired by a world famous photographer to travel around the world, literally go to the Arctic, to the Antarctic for 6 months to coach him on this process.
Mhm. Perfect.
Yeah.
Okay, so we've kind of teed it up. If people listen to this, they're probably like, "Well, what are you guys talking about?" So
Yeah.
tell us what is it that you're talking about? What did you develop?
Yeah. So when you think about the nervous system in you, we have several different kinds. So the kind that I'm talking about is that fight or flight nervous system that
Mhm.
ramps you up. So there's the autonomic nervous system. It has three branches. We'll focus on rest and relaxation and then fight or flight mode. And that also includes freeze and fawn, which is like people pleasing to try to calm down a danger that's approaching you.
Mhm.
So ideally, we're designed to be in more that rest relaxation stage most of our waking and sleep nighttime hours. But because of our society, we're ramped up, with work stress, financial stress, relationships, kids, parents, driving, economy, state of the world. We're ramped up. And what we want to do is calm ourselves back down. Now, there are a lot of ways to do that in terms of your brain and maybe your mind, your mindset with looking at meditation
Mhm.
or journaling or spending time out in nature. But one of the things that I look at is if your physical body is set up to be existing in a fight or flight mode and pattern, everything else is then perceived at a greater danger.
Mhm.
So if my physical body and how I position myself is set in fight or flight mode, my breathing pattern will also be set in fight or flight mode. So that's going to make me feel on edge, and then let's say all of a sudden I get a call from my boss and he says something that doesn't, really resonate with me. Now my appearance of that being a stressor is going to be even greater.
Mhm.
So what I want to do is work on changing how you hold your body, change how you breathe, the mechanics of it, pair those two together so your body feels calm, it feels secure, it feels safe, and you release a lot of the emotion that's stored in your body based on past experiences. And so that's what we do. So when let's say I was working with you, I would
Mhm.
look at how you're sitting, how you're standing, how you're walking, how you reach, how you bend over, how you squat to lift something up. I'm going to look at all those patterns because all of those daily movements are done either in a fight or flight pattern or a relaxation pattern.
Mhm.
And how you do those affects how you breathe. So we want to look at all of that and then teach you how to change the way you hold your ribs so it calms you down and you feel the tension in your body release to allow bones to go back into a neutral position where there's space
Mm-hmm.
to help alleviate pain, to alleviate stress and anxiety, insomnia. Some people even have the benefit of it decreases their high blood pressure, or they need to take less of those medications, or even less of their diabetes medications or pain medications. So we look at what is it that you're trying to achieve.
Mm-hmm.
Sometimes it's people who they don't really have any body pains, but they're looking that they want to improve their performance, like maybe entrepreneurs or business owners, where they want to improve their focus or attention or creativity or imagination.
Mm-hmm.
But it's hard to do that if you don't feel safe in your body. In fact, you can't, because if you're not feeling comfortable and safe in your body just goes into this laser focus. It's called narrow focus versus open focus, where you can take things in and be imaginative and creative.
Fascinating. So is it a daily practice then, like a breathing practice, or how does it look?
Mm-hmm. Yeah, a great question. So first, it is a process to learn how to make your body feel safe again. So we go through this process where each week you're learning a little bit more and shifting and changing your body. Then when you get to the point where you feel completely free and mobile and release, then there's usually a couple positions that we give you and say, okay, this is what you want to continue doing here on forth. Because you want to make sure you can always sense different aspects of your body to make sure you're not storing some of the stresses and trauma of daily life, but also that you are feeling like you're releasing and freeing. And I say it is a daily practice because you will have stressors on a daily basis, period. We all do.
Yeah.
You want to be able to release every one of those stressors on a daily basis, because they build up and your body starts to change in micro little bits every single day. And that's why someone who, like, I have a lady, she's a retired psychologist. I started seeing her when she was still a psychologist. She's in her 70s. She came to me for knee pain. She was scheduled for a knee replacement. She came to see me in June and she was scheduled in August of 2016. And she had been doing injections 3 times a year and daily anti-inflammatories for a decade. And she's like, you know what, I'll drive an hour, I'll give this a chance. And so I started working with her and I said, listen, you've already tried traditional therapy. She was one of the people that says, okay, I'll try the weird stuff that you're doing.
Yeah.
And I said, okay, we're not going to touch your knee, because she didn't want anyone touching her knee. It was too painful. And I said, we're going to start practicing and changing the way you hold your body and the way you breathe. That's all we're going to work on. And so we did that. And the next time she came to see me, she's like, how quickly is this supposed to work? And I said, well, it can work quickly, but it depends on you. And she's like, well, the pain is no longer there, but I don't believe this is really it. So that's fine. She came back again. And the next week, she came back and her pain still hadn't returned. And she hadn't existed without pain for a decade. Wow. And so she canceled that surgery. That was in June of 2016. She still hasn't had that surgery. And she hasn't gone back onto daily anti-inflammatory. She stopped doing those. She hasn't had an injection again. She's in her late 70s now, and she travels all over the world. She climbs in and out of zodiacs and does little hikes and stuff. And she's a wildlife photographer. And so, wow, you have to get into weird places to photograph wildlife. But that's an example that she does a daily practice, and it's just to help her release the tension that developed in her body based on a career where she was helping people, and she heard a lot of trauma and stories. And that's a stressful career. We all have those types of things. So we need to release it every single day. It's so critical to our well-being to release that stress tension that starts to pull our bones slightly out of position.
So let's go back to that lady. So did she have like some sort of diagnosis, which, arthritis or something like that? And was it a total knee replacement she was being offered, or?
Yep, she was told, and it's true. It's not like it was fabricated. She was bone on bone, osteoarthritic. She had no cartilage left. She was in line for a total knee replacement.
Okay.
Complete and utter Mhm.
when people, so, I have people come to me all the time like this, and perhaps you do too. It's like they get that X-ray or they have that MRI and they're told by the doctors, bone on bone, it's not going to grow back.
Yeah.
The pain won't go away unless we remove your joint and put in a new one.
Yeah.
So that's the mindset of most people. There's nothing to be done.
Mhm.
She was willing
Mhm.
to take that leap, but how does that
Mhm.
work? Then you talked about the tension, but talk us through it, like the either the theory
Mhm.
or what you understand of
Yeah.
how did the pain go away?
Yeah, absolutely. So imagine the stressors that we talked about, all your daily life
Mm.
stressors. Every time you have a daily life stressor, your body develops muscle tension. And I tell people this little story. If I hear a loud bang right now and it sounds like a gunshot and I tense up based on fear, I can feel that tension.
Mhm.
That's sympathetic tone. So imagine all of your daily life stressors causing some tension in your body. If you don't pause and release that tension, like I'm saying to do on a daily basis, if you don't do that, your nervous system thinks it's supposed to keep telling those muscles to behave that way. So your muscles stay tense, especially if you don't realize that you need to release them.
Mhm.
Most of the time, we don't even feel them become tense because we're just on the edge of our seat and we're just, ramped up. But over time, it starts to pull on your bones, it starts to pull them just a little bit more, a little bit more. And especially if you're not positioning your rib cage in a neutral position and you're kind of chest out a little bit and shoulders back a little bit too much, a slightly off position. Because as soon as you do that, your pelvis tips forward. Now the mechanics of your knee are going to be off
Mhm.
just based on how you position your rib cage. You add that to this stress tension that develops over time, it's going to pull your bones out of a position where they had the most space.
Mhm.
And eventually there's wear and tear. And those muscles tighten up more and more. And eventually they pull on your bones just enough that tissues start to hit each other and the pain develops. And so with her, she had so much tension from the way she sat and held her stresses from her career and, of course, other life stresses. She didn't feel all these subtle changes over the years. So what we did was change the way she held her body. So she stopped sticking her chest out, pulling her shoulders back. She stopped arching her back, sucking up her gut.
Mhm.
She let her rib cage drop down. She let her belly spill out so her pelvis could relax. When her pelvis relaxed and rotated back a little bit and relaxed the front of her hips, the hip flexors, guess what? The knee joint went back into a neutral space. She no longer had tissues beating up against each other. Pain went away. She could move her knee, she could bend, she could squat. She learned how to use her thigh muscles again. And voila, she didn't have to have surgery. Is her arthritis still there? Yes. The
Mhm.
cartilage is still gone? Yes. Is she still bone on bone? Yes. But guess what? The bones aren't touching because her bones went back into a space where they're not supposed to
Mhm.
touch. So,
Exactly. And that
yeah.
is brilliant. I love the way you describe that, the mechanics all the way down. And I think a
Mhm.
lot of people feel as though once they get that definition of arthritis, that it's going to only ever get worse. But we
Mhm.
can have, I mean, there's studies that show that people have all sorts of injuries without pain. And then you can have pain without injuries, then you can have injuries and pain. And so it doesn't
Yeah.
always correlate. And this
Yeah.
is something I try and explain to my clients as well. I'm like, okay, I see you got this diagnosis, but there's
Mhm.
lots of other people with that exact same diagnosis that have no pain. So
Yeah.
we can't say 100% hand on heart that that diagnosis causes pain. And
Yeah.
it's a really kind of tough thing, tough sell to sell that to a client when they're in pain. But to explain to
Yeah.
them, and then I'm sure this works with you as well. You say, well, okay, if it is that, and we do this first treatment and you get a little bit better, it can't be that because we can't change that in one treatment.
Yeah.
And
Yeah.
and then you get the buy-in, and that's how I do it as well. Okay, so
Yeah.
I was thinking about when you're. Sorry, I'm going to shift back slightly to your running.
Uh-huh.
Right, you've done
Mhm.
a lot of running. You mentioned the marathon, training for marathon, but I also
Mhm.
know that you've done these ultra marathons as well,
Yeah.
and
Mhm.
multiple marathons, not just one
Yes.
or two. How many have you
A
done?
lot. I've done over 40 marathons. I've lost track on there. And then I've done 10 ultra marathons, which is a distance greater than 26.2 miles.
Right. Okay.
Yeah.
And so, in my experience of runners, that it can be slightly addictive to run, and I'm a runner
Yes.
as well, so I put myself in that
Yes.
category. And there is a physiological change that happens because some people say we're not really designed to get out of bed, drink a cup of coffee and then just start running. It's like saying to the body, hey, we're being chased every day by something, and we can get a lot of tension build up, and we can get, 80% of runners have some sort of injury. But you worked on yourself and to change that. And have you done this with lots of runners as well? Have you had experience with that?
I have, yes. And so I've actually done it with especially people who want to run marathons or ultra marathons, train them how to be able to run 50 miles pain-free, or to get through a 100-miler with minimal to no pain in terms of like joint pain and that. Obviously, there's pain related to fatigue of the muscle, but we want to get you through it so that you don't have like the sharp pains that contribute to like some kind of actual damage to you. And so I do work with people and train them on how to do that, and if in the middle of a run you start to develop pain, how do you get out of it? Because that's critical. Because when you develop pain in a run, it's usually some muscles have fatigued, leading you to compensate with something else that wasn't designed to be used. Because your brain, all it perceives is run and get to that finish line. Your body just is like, okay, I will use whatever I can to create that accomplishment. So sometimes when you get fatigued, or let's say you're running on a slant and your body's not prepared to run on a slant and you're using different muscles. So periodically we have to say, okay, nervous system, calm back down. Let's get back to how was the body designed to move forward as I'm running, so that way I'm not pinching tissues together.
Okay. And is nasal breathing part of this? Because there's a big move in the running community now to take the stress. Well, when you breathe in through your mouth, it heightens that sympathetic response. So you increase your stress. But when you breathe through your nose, it dampens it slightly. And that's what I've heard and read about. Is there something in that for you as well?
Yeah, so part of the process that I teach is breathing in through the nose. Now, when you're running, there's a little caveat to it. If you've trained yourself to breathe in only through the nose, and obviously continue with that, if you're running at a faster pace, where you're clipping it, you're trying to qualify for Boston, you may not be able to only breathe in through your nose. And I'll say, try to breathe in through your mouth and nose at the same time. And the key is that, can you keep your rib cage down as you're inhaling to support your diaphragm? So that way the diaphragm helps pull air in instead of you lifting your ribs up. And try to get away from belly breathing, which is abdominal distension and creates a lack of stability for the diaphragm. Can we get you to support the diaphragm by keeping the ribs down and the side abs active? And so when we do that, you can then draw air in, so you don't have the rib cage lifting up and down as you're running, which wastes a ton of energy and encourages the back to participate in the breathing process. And when your back muscles are contracting, they're crushing on that fight or flight nervous system that lies along your spine. So we are trying to get you away from overactivating that. So there is some mechanics of when you're running, you do want to breathe in through your nose, but you want to make sure that rib cage is not flaring up from the bottom, which is often taught, unfortunately.
All right. So I'm still trying to sort of learn the basics of it. You've got the circumference of your lower thoracic area, and a lot of people in the breathing space talk about this belly breathing. And you mentioned that can make your diaphragm unstable. Okay, so the belly breathing, for my listeners, that's when you breathe in and your belly distends, it gets larger. And then even some people will say, well, your ribs aren't meant to move at all. You're just your belly. But you're saying something different. Is that right? Tell us what that is.
Yeah, so I challenge people when they do belly breathing for a couple of reasons. So when you breathe in and you push your belly out, often you're activating your back muscles too. So, and you're trying somehow to get air to go to the bottom of your lungs. So our lungs, imagine they're two big balloons. We'll just simplify it, even though there's different lobes. So we're just going to simplify it. There's two balloons on each side of you. Those balloons are supposed to inflate in a three-dimensional pattern, not just the base of the balloons, but three-dimensional. So I encourage people that when you inhale, you want to feel, like actually feel your lungs expand from the inside out. And you might feel a gentle expansion up at the top by your collarbone because your lungs go all the way up there. You might feel a tiny bit in your chest. You might feel in the sides. And you also want to feel a little bit in your back. So much of what we're taught is chest out, shoulders back, suck up your gut, and you lock down the back of your lungs because you're trying to train those back muscles to flatten that curvature of your spine, even though for some reason we've come to this idea that a flat back is beautiful, but that you're closing off half of your lungs, the back half of your lungs, and they're supposed to expand as well. So instead of pushing out your belly to breathe in and keeping everything locked at the top and in the back, let's have the rib cage drop back down into neutral. The side abs help hold it there. So it provides support to the diaphragm wall so the diaphragm can drop down and you draw air in. So it inflates all of your lungs. It feels very good.
I like that. Yeah, I mean, when we look at the lungs, they travel, they attach at the back way further down than we think they do. And
yes.
I've people say, "Oh, do I lift and breathe out, or do I do the movement and breathe out at the same time?" And I do some corrective movements for my clients with back pain and scoliosis. And I say to them, "Okay, I want you to do 5 where you're doing the movement and breathing out, and then do 5 when you're doing the movement and breathing in, because in life you do both in life, and that the like you said, there's the little lobes in the lungs and the length of it all needs to be inflated in different positions." And I just really sort of gel with what you're saying there, that if we can get these side ribs to form some sort of stability, then the diaphragm gets to pull and move on something.
Yeah, you're absolutely right. I'm so glad that you tell breathe both ways, because you literally do that in life. And I give people an example. If you imagine your rib cage is like a cylinder, you want your cylinder vertical, because as soon as you tilt it on its edge, it's going to fall over. And so we want a rib cage vertical, not tilted, where our chest is thrown out and then you're hinging off of your back. And the other imagery is, if you imagine your diaphragm is kind of like a barn silo where you store hay in that. You have a dome on top of walls. So if the dome is going up and down, it needs those walls to be strong and supported for that dome to go up and down to draw air in. If the silo walls are just a crumble mess, the dome's not going to really do much. And that's when you see people lift up their rib cage or try to shove their belly out just to try to draw air in. But if those walls are stable, then that dome can do its action and it can draw air in. And the process of using that dome helps calm you down as well. And it helps you not use your back. And as soon as you stop using your back for breathing, that calms you down as well, because you're not stimulating that fight or flight nervous system.
Fascinating. So have you got sort of, for some of my clients who have back pain or scoliosis, have you got a client in mind or a patient that you work with that came with back pain and you didn't mess with their back? You just did this? Does anyone spring to mind?
Yeah, I have a lady. I just recently, just during the pandemic, she literally called me, and she was in tears. She's like, "I can't move. I can't do anything." And I said, "Okay, let's start working." And so we started off with just having her sit in a chair if she could, or lying down on her back with her knees, bent and supported. And we started going through changing how she held her rib cage and the mechanics of how she breathed. And, after she got through that and she could feel her body relaxing, which then decreased the pain, then we had to teach her, how do you stabilize your body in that new position? Because as soon as she went to stand back up, she's going to revert to the old habits of how she used her muscles in her body, which led to that pain. So it's a process of learning how to stabilize yourself so that you can keep yourself in that position that your body was designed to have. So you didn't revert back to those muscles that cause the compression, that cause the pain. And I mean, she was having symptoms down her leg, this tingling, this tightness. I mean, she couldn't sit, she couldn't stand. Now she's completely fine. And I kid with her and I harass her. I say, practice, because we've worked to change how you form your habits and how you keep your habits. But there is still that response when she gets in stress mode. It's very easy to fall back to something that was ingrained in her for 45 years versus something that we've worked on changing over a year. So I'm like, there's still that underlying pattern that when you're in extreme stress, you could fall back into. So keep practicing.
Well, in some ways, having a painful tell is actually good feedback for a person. There's a lady who I've interviewed called Dr. Terry Walls, who has MS. If she eats gluten, she gets trigeminal neuralgia, which is a really painful face. And she says that the biggest problem she has with some of her clients is that when she works with them, they have no they have nothing, they have no symptoms. So they get better. And then they go, oh, I'll just have that birthday cake. Oh, I'll just have this. I'll just have that. And then a year later, they're in pain. Whereas she's like from one meal to the next, she's in pain. And she actually thinks it's the best thing. It's the worst thing that can happen, but it's the best thing for her because it keeps her keeps her practicing and keeps her on the straight and narrow all the time.
I totally understand that. It's true. I actually have a client right now who a very, very similar story. She came to see me for anxiety and stomach issues, and we worked on calming down her nervous system. She was great. She changed her eating habits, and she went to go explore over in Germany, doing fabulous stuff, but her eating habits and things changed. And within a month, things started showing up. And we just had a chat and said, hey, let's look at how your habits have changed since you've gone over there. And let's go back to, you can, obviously stay there, but let's change your habits back. And poof, everything started improving again. It's scary how quickly it can change.
Yes, exactly.
Yeah.
Okay. So I think I've got a good idea of the method and how you've developed it and the clients you help and what sort of symptoms you help them with. How can people find out more about you and even perhaps participate in this?
Yeah, absolutely. The easiest way is to go to the website, PABRinstitute.com, PABR Institute.com. And there's many ways to get involved. I have a online course that's launching. I have a couple different things related to that. We do a fundamentals course that goes into an advanced course if you want to learn more, or there's always one-on-one, as well as many free resources depending on kind of where you are in your journey. But either way, if you want to participate in something, I always have the option that we can have a discovery call just to make sure you are set up for your needs.
Perfect. All right. Well, thank you very much. So if you want to find out more about Amy and her work, you've got the website there, and I'll post that in the links below, and you can just click that and find out everything you need to know about her. Thank you very much, Amy.
Thank you, Ed.
That was truly fascinating. I love speaking to people like Amy, who are original thinkers, who are self-experimenters, and who have discovered something new. Now, breathing has such wide implications, and breathing properly is something, strange enough, that many people don't know how to do. It's not their fault. It's just that they have defaulted into a type of stress-related breathing, which has consequences, like Amy alluded to, with pain and a whole host of other things. If you like this podcast, I really want you to like and subscribe wherever you get your podcasts so that you don't miss my next episode. And if you can, leave me a review. If you also want me to interview a certain guest, drop me an email at ed@edpaget.com with their name and their details and why you want me to interview them. And I'll reach out to them, or maybe even you can make an introduction and we'll get them on the show as well. See you in the next episode.